Have you ever done everything your doctor told you to do? Cut back on protein, avoided salt, took your medication exactly on time, and still watched your creatinine numbers climb? If that sounds familiar, what I'm about to tell you may be uncomfortable, but it could also explain why your kidneys are quietly getting worse. Because here's the question. No one asked you during those appointments, what if the problem isn't what you've reduced in your diet, but what you're still eating every single day without a second thought? And what if that one safe food is putting more stress on your kidneys than meat ever did? I'm Dr. Richard Hale, and after decades of working with patients who were told they were doing everything right, I've learned something most people only discover when it's almost too late. Kidney damage rarely comes from one dramatic mistake. It comes from small, repeated choices that overload kidneys already struggling to survive. And one of the most dangerous choices hides in plain sight on your dinner plate, in your breakfast bowl, and the food you were probably told was harmless. Rice, not salt, not sugar, rice. Because while you're focused on sodium and protein, certain types of rice are quietly flooding your bloodstream with minerals your kidneys can no longer filter. That excess doesn't simply disappear. It builds up silently, hardening arteries, straining your heart, and accelerating kidney decline in ways medication cannot reverse. And this is where the situation becomes urgent. Some rice varieties can push failing kidneys closer to dialysis within just a few years, while others, when chosen correctly, can actually reduce that burden and give your kidneys room to breathe again. The difference between these choices is not subtle, and it's not opinion. It's measurable, repeatable, and backed by real clinical outcomes. In the next few minutes, I'm going to show you 3 types of rice that can help protect your kidney function, and 3 types that people with high creatinine should never touch again. If your kidney numbers matter to you or to someone you love, this is information you cannot afford to miss. What most people don't realize is that when creatinine starts rising, your kidneys are no longer failing all at once. They're failing selectively. Certain filters are gone, others are barely hanging on, and every meal becomes a math problem your body has to solve. I remember a patient who sat across from me, frustrated and exhausted, telling me he had already given up steak, bacon, even cheese, yet his lab results kept getting worse. When I asked him what he ate every morning, he answered confidently, brown rice. The healthy kind. That single sentence explained everything. Because when kidneys weaken, the goal is no longer more nutrients, it's less strain. And this is where the first rice that actually helps your kidneys comes in long-grain white rice. White rice has been criticized for decades, but those criticisms were never written for people with compromised kidney function. 1 cooked cup of long-grain white rice contains roughly 45 milligrams of phosphorus and about 50 milligrams of potassium levels that damaged kidneys can still manage. Compare that to many whole-grain options, and the difference isn't subtle, it's overwhelming. By removing the bran and germ, white rice removes the very layers where phosphorus and potassium concentrate. That means fewer minerals entering your bloodstream, less work for your nephrons, and less silent damage accumulating over time. This isn't theory. Kidney care organizations analyzing patient outcomes found that people who switched from whole grains to white rice often saw lower blood phosphorus levels within just a few weeks. Their kidneys weren't magically healed, but they were no longer being forced to run at full capacity every single day. And that matters because kidney decline is not about speed, it's about pressure over time. Now, preparation matters. Rinsing white rice for 30 seconds before cooking removes excess surface starch, and cooking it simply without heavy sauces, butter, or sodium keeps it kidney-friendly. This isn't about deprivation. It's about choosing foods that stop quietly sabotaging your progress. But here's the part most people miss. White rice doesn't just reduce mineral load, it creates a foundation, a base your kidneys can tolerate so everything else you eat doesn't push them closer to failure. And that foundation becomes even more powerful when paired with the right alternative options. Because knowing about white rice alone isn't enough. There's another rice most people think is harmless, but it behaves very differently inside your body, especially if blood sugar is part of your kidney story. Now, if white rice creates a safe foundation for struggling kidneys, the next question most people ask me is, what if blood sugar is part of the problem too? Because for millions of people with rising creatinine diabetes or insulin resistance isn't a side issue. It's the silent force damaging kidney blood vessels day after day. I once worked with a patient whose kidney numbers stabilized after switching to white rice, but his energy crashes and glucose spikes never stopped. He felt like he was choosing between protecting his kidneys or controlling his sugar, and that's when I introduced him to a rice most Americans recognize, but almost no one understands correctly: basmati. Basmati rice looks similar to white rice on the plate, but inside the body it behaves very differently. One cooked cup contains roughly 50 milligrams of phosphorus and about 60 milligrams of potassium, which keeps it within a kidney-safe range. But the real difference shows up after you eat it. While standard white rice has a glycemic index that often climbs into the low 70s, basmati typically falls between 50 and 58, meaning it raises blood sugar more slowly and more gently. That matters because repeated glucose spikes damage the tiny blood vessels feeding your kidneys, accelerating decline even when mineral intake looks acceptable on paper. There's another layer here most people never hear about. Basmati contains higher levels of resistant starch, a form of carbohydrate that isn't rapidly digested. Instead of flooding your bloodstream with glucose, it feeds beneficial gut bacteria. Those bacteria produce compounds that reduce systemic inflammation, and inflammation is one of the quiet drivers of kidney scarring over time. Western nephrology dietitians noticed this years ago when reviewing patient data. People who regularly replaced standard white rice with basmati often showed steadier blood sugar patterns and slower kidney function decline over 12 months. Not dramatic headlines, but meaningful preservation of function in real lives. Preparation still matters. Rinsing basmati thoroughly before cooking removes excess starch that can spike glucose unnecessarily, and cooking it plainly without sodium-heavy seasonings keeps its benefits intact. This isn't about perfection. It's about stacking small advantages that add up over months, not days. And here's the deeper truth. Basmati isn't just an alternative. It's a bridge. It allows people managing both kidney stress and blood sugar instability to stop feeling trapped between two bad choices. But even with basmati, variety still matters because dietary boredom is one of the fastest ways people abandon kidney-safe habits altogether. And that brings us to the next rice, one that surprises people even more because it feels indulgent yet behaves far more gently than anyone expects. If basmati acts as a bridge for people balancing kidney stress and blood sugar, the next challenge most patients face isn't medical at all, it's psychological. People don't abandon kidney-safe eating because they don't care. They abandon it because food becomes boring, restrictive, and joyless. I've seen it countless times. Someone follows the rules perfectly for a few weeks, then one night they crave comfort flavor, something that feels normal again. And that's usually when they drift back to foods that quietly undo their progress. This is where the third rice option becomes so important because it offers something many kidney patients desperately need: variety without punishment. Jasmine rice carries a familiar aroma that reminds people of home cooking, not hospital diets. And what surprises most patients is how gently it treats weakened kidneys when eaten correctly. One cooked cup of jasmine rice contains approximately 44 milligrams of phosphorus and about 48 milligrams of potassium, almost identical to long-grain white rice. From a kidney filtration standpoint, that means the workload placed on your nephrons remains manageable instead of overwhelming. Your kidneys don't have to sprint just to clean your blood after one meal. Now, jasmine rice does have a slightly higher glycemic index than basmati, typically ranging from the high 60s to around 80. But this is where context matters more than labels. Clinical nutrition guidelines recognize jasmine rice as kidney-friendly when portions are controlled. A serving of 1/3 to 1/2 cup cooked paired with low-potassium vegetables like cucumber, bell peppers, green beans, or cauliflower keeps both mineral load and blood sugar response within a range most compromised kidneys can tolerate. I remember a patient who told me jasmine rice felt too indulgent to be safe. Yet when we measured his labs after adjusting portion size, in food pairing, his swelling decreased and his energy improved, not because jasmine rice was magical, but because it made consistency possible. And consistency, not perfection, is what slows kidney decline. Preparation plays a role here too. Rinsing jasmine rice before cooking removes excess starch, and letting it steam briefly after cooking improves texture without adding fat or sodium. The mistake many people make is treating jasmine rice like restaurant food: large portions, butter, coconut milk, heavy sauces. Those additions cancel out its benefits and force kidneys to retain fluid and work harder. Here's the deeper insight most people miss. Jasmine rice isn't about indulgence, it's about sustainability. It allows you to stay on a kidney protective path without feeling deprived, which dramatically increases the odds you'll stick with these changes long term. But before you feel relieved, there's something critical you need to hear next. Because while these three rice types can protect your kidneys, there are other varieties that do the exact opposite, and the next two are the ones that shock people the most. Now, this is where the conversation takes a hard turn, because the next rice isn't just misunderstood, it's actively dangerous for people with rising creatinine. Brown rice has been praised for decades as the smart choice the grain doctors and magazines told everyone to switch to. And that advice works beautifully for people with healthy kidneys. But once kidney function starts slipping, brown rice quietly becomes a liability. I've had patients look at me in disbelief when I tell them this because brown rice feels responsible, disciplined, even protective. One man told me he forced himself to eat it every day because he believed suffering through bland food meant he was doing the right thing. Meanwhile, his lab results kept deteriorating. The problem lies in what brown rice keeps that white rice removes. 1/2 cup of cooked brown rice delivers around 81 milligrams of phosphorus, nearly double what you'd get from a full cup of long-grain white rice. And phosphorus is not a neutral nutrient when kidneys are compromised. When your kidneys can't excrete it efficiently, phosphorus builds up in the bloodstream, pulling calcium out of your bones and depositing it into your blood vessels. Over time, that process leads to vascular calcification, higher blood pressure, and increased risk of heart attack and stroke complications that often appear before dialysis ever enters the picture. There's another layer most people never hear about. The bran layer in brown rice doesn't just concentrate minerals, it also accumulates inorganic arsenic from soil and water as the rice grows. Healthy kidneys can eliminate small amounts over time. Struggling kidneys cannot. Studies consistently show that brown rice contains significantly higher arsenic levels than white rice precisely because the bran is left intact. That toxin doesn't cause symptoms overnight, but it adds another burden to kidneys already operating with fewer functioning filters. This is why kidney specialists don't talk about brown rice as healthy or unhealthy. They talk about it as context dependent. Once creatinine rises and filtration drops, brown rice stops being fuel and starts becoming friction. Every serving forces damaged nephrons to work harder than they're capable of sustaining accelerating decline in a way that looks invisible until it isn't. And this is the most painful part. Many people damage their kidneys faster because they're trying to be healthy. They follow outdated advice that was never meant for kidneys under stress, and they pay the price months or years later. But if you think brown rice is the worst offender, stay with me because the next rice makes brown rice look almost safe by comparison, and it's hiding behind an even stronger health halo. If brown rice quietly accelerates kidney damage, the next rice takes that danger and turns it up several notches. Wild rice carries a powerful reputation. It's dark, hearty, expensive, and almost always placed next to quinoa and specialty grains in health food stores. Restaurants charge extra for it, and cookbooks praise it as nutrient-dense and ancient. That image alone convinces people it must be doing their bodies a favor. But for kidneys already struggling, wild rice is not nourishment, it's overload. I once worked with a patient who proudly replaced white rice with wild rice, believing he had made the ultimate upgrade. Within months, his potassium levels became unstable, and his kidney function declined faster than expected. Nothing else in his diet had changed. Here's why that happens. 1 cooked cup of wild rice contains between 150 and 200 milligrams of phosphorus, along with 150 to 180 milligrams of potassium. That's 3 to 4 times the mineral load found in kidney-safe rice options. For healthy kidneys, that's manageable. For kidneys with rising creatinine, it's an impossible task. Those excess minerals don't just sit harmlessly in your blood. Potassium disrupts the electrical signals that control your heartbeat, increasing the risk of dangerous arrhythmias. Phosphorus pulls calcium from your bones and deposits it into blood vessel walls, stiffening arteries and raising blood pressure. At the same time, your kidneys are losing filtration capacity. What makes wild rice especially deceptive is that people assume smaller portions make it safer. Unfortunately, that logic doesn't hold. Even modest amounts deliver mineral concentrations that damaged nephrons cannot process efficiently. Kidney care guidelines in multiple countries specifically advise patients with elevated creatinine to avoid wild rice entirely, not reduce it, not dilute it, but remove it. That recommendation doesn't come from theory. It comes from watching patients deteriorate while eating foods they believed were protecting them. The mechanism is brutally simple. As creatinine rises functioning, nephrons decrease. The remaining ones work overtime just to keep you stable. When a food like wild rice floods your bloodstream with phosphorus and potassium, those remaining filters are forced into constant overdrive. Over time, they fail faster, not because of disease progression alone, but because of relentless dietary pressure. This is why wild rice doesn't cause immediate symptoms. It causes silent acceleration. You feel fine, you feel healthy, and then suddenly your labs don't make sense anymore. But as dangerous as wild rice is, it's still not the most destructive option on this list. There's one more rice that looks even more impressive, markets itself as a superfood, and does something far more damaging inside weakened kidneys. And that's what you need to understand next. If wild rice overwhelms the kidneys through sheer mineral load, the final rice on this list does something far more dangerous and far less visible. Black rice, sometimes called forbidden rice, is marketed as a superfood reserved for royalty, loaded with antioxidants, anti-aging compounds, and deep purple pigments that promise protection and longevity. I've had patients proudly show me bags of it, convinced they were making the smartest possible choice for their health. One woman told me she switched to black rice specifically to fight inflammation. Within months, she developed recurring kidney stones and unexplained flank pain, something she had never experienced before. The connection wasn't obvious until we looked deeper. Here's what makes black rice uniquely destructive for compromised kidneys. One cooked cup contains roughly 180 milligrams of phosphorus and over 200 milligrams of potassium, already placing it among the most mineral-dense grains you can eat. But the real threat isn't just those numbers. Black rice is also very high in oxalates, natural compounds that healthy kidneys normally filter and excrete without issue. When kidney function declines, that process breaks down. Oxalates begin to accumulate in the bloodstream, where they bind tightly to calcium and form sharp calcium oxalate crystals. Those crystals don't just pass quietly. They lodge inside kidney tissue and urinary passages, triggering inflammation, blocking urine flow, and physically damaging the delicate filtration structures your kidneys rely on to survive. Nephrology research has repeatedly documented how oxalate accumulation accelerates kidney stone formation and worsens renal injury in people with already reduced filtration. This is not a slow nutritional trade-off, it's mechanical damage happening at the microscopic level. The cruel irony is that black rice's antioxidants do offer benefits for people with normal kidney function. But once creatinine rises, those benefits become irrelevant. Antioxidants cannot compensate for crystals forming inside organs that are already failing. Marketing ignores this distinction because it targets healthy consumers chasing wellness trends, not patients fighting to preserve organ function. What makes black rice especially dangerous is how convincing it looks. Darker color, higher price, stronger health claims, it all signals better. But for struggling kidneys, black rice isn't better, it's the final straw. And because the damage happens quietly, many people don't connect the dots until stones infections or sudden drops in kidney function force the issue. Now you've seen the full picture. 3 rice types that protect kidneys and 3 that actively destroy them. But knowing this difference alone won't change outcomes unless it turns into daily action. And the final piece, often overlooked, can determine whether these choices actually slow kidney decline or simply delay the inevitable. If you've made it this far, I want you to pause for a moment and take a breath, because the most important thing you need to hear right now is this: you are not powerless. Rising creatinine does not mean you failed, and it does not automatically mean dialysis is inevitable. It means your kidneys are under stress, and stress can be reduced when the right pressure is removed. Small, consistent changes, like choosing the right rice, controlling portions, and avoiding foods that silently overload your kidneys, can buy your body something incredibly valuable: time. Time for your kidneys to stabilize, time for inflammation to calm down, and time for you to regain a sense of control over your health. I know this journey can feel overwhelming. Many people feel guilty, confused, or scared when lab numbers don't improve despite their best efforts. If that's you, please understand you're not alone and you're not weak. Kidney disease is quite complex and often misunderstood even by people who are trying to help. But knowledge, when it's accurate and applied daily, is one of the strongest tools you have. If this video helped you understand your kidney health more clearly, I encourage you to save it. You may want to come back to it or share it with someone you care about who's facing similar challenges. And if you want to keep learning how to protect your kidneys with evidence-based practical guidance, make sure to subscribe to the channel and turn on notifications. I share updated medical insights, nutrition strategies, and real-world advice designed specifically for kidney health, so you don't have to sort through confusing or outdated information on your own. Most importantly, don't lose hope. Kidneys respond to consistency, not perfection. Every meal is another chance to support them instead of harming them. And when you make informed choices day after day, you give your kidneys the best possible chance to keep working for you. Your health matters, your future matters, and with the right information, you can still change the direction of this story.